The rise of bioethics and the emergence of the legal doctrine of informed consent in the late 1950s should have had a greater impact on patients. Informed consent is based on a shared decision between physician and patient, with the physician understanding the relevant values of the patient and the patient understanding the nature of the disease and intervention, including risks and benefits.
Informed consent has developed rapidly since it was introduced in the 1950s. When talking about medical ethics, invasive brain surgeries also have an unethical bridge past, particularly in treating mental health disorders.
Back in the 1950s, doctors in the US performed more than 40,000 lobotomies. These major procedures would implicate all brain connections, but they were sold as a miracle cures, even though there was a lack of scientific evidence they could actually help patients. No guarantee of the procedure.
Doctors were aware of their terrible side effects, such as blunting of emotions. The worst part is that these severe side effects wouldn't be recorded in any scientific paper. There were also issues with medical consent of patients who may not have the ability to fully advocate for themselves.
The lack of knowledge of the procedure that was made in the patient's brain was unethical because it didn't take into account the possibilities of risk during the procedure, not letting the family and patient know the health consequences. Practicing medicine in patients as if there were experiments with the development and clinical application of new therapies and technology. While many of the patients were incapable of making an informed choice, consent would prevent patients from becoming overwhelmed.
The Presidential Commission's report points out that researchers using deep brain stimulation may have paying very close attention to this sort of ethical questions. So far, researchers have worked with ethics and patient advocates to create basic and fundamental standards that include fully informed consent and the management of expectations.
Informed consent law covers the legal aspect regarding an individual's right to be informed of and consent to a procedure of treatment suggested by a physician or professional. This written authorization can limit professional liability issues for the individual providing the service.
Prior to signing this agreement, ethics dictate that a physician providing or performing the treatment and/or procedure should discuss with the patient diagnosis, the purpose of the treatment or procedure, the risks involved, alternative treatments, and the risks and benefits of refusing treatment. The patient can take an informed decision to accept or refuse the treatment or procedure. In the event that the patient is incapacitated to the point of not being able to make an informed decision, a family member, as authorized by law, can replace the patient.
Medicine Plus and patient rights. As a patient, you have certain rights. Some are guaranteed by federal law, such as the right to get a copy of your medical records and the right to keep them private. Many states have additional laws protecting patients, and healthcare facilities often have a patient bill of rights. An important patient right is informed consent. This means that if you need a treatment, your healthcare provider should give you the information you need to make a decision.
Organizations related to informed consent law: Agency for Healthcare Research and Quality, HHS, Office for Human Research Protections, Consent to Treatment, Children and Young Persons Care and Protection Act, 1998, Guardianship Act, in 1987, Guardianship Regulation 2016, Minor Property and Contracts Act, 1970.
Policy Directives PD 2011-022 Your Health Rights and Responsibilities, PD 2005-406 Patient Information and the Concept of Medical Treatment.